and that kind of stuff. So all the stuff that we learned yesterday, neuromuscular facilitation test, palpation, all the stuff we learned today, neuromuscular facilitation test, palpation, we went through roughly 130 muscles. If you take all that stuff and you run through that and your patient looks better on the table, and even if you get them off the table and you go through the functional screen and that looks better and you don't do the exercise, you didn't do anything functional. So nothing that we did on the table yesterday or today was functional. It's all laboratory type stuff. So me, you seeing what they can and can't do, reverse that. If they don't have to reinforce that with something, they're not going to break their compensation patterns. So they'll feel better for a little bit when they leave, but then all that stuff is going to come back because you didn't give them anything to get them out of the broken compensation pattern that they had when they came in. So that's why exercise is important. And on the flip side, if they just came in and we watched them do their screen and we didn't do anything to assess insufficiency, neuromuscular insufficiency, then we don't know what the root cause of the problem is. If we just gave them exercises for that, we just reinforced the broken patterns that their body figured out by itself. So we didn't do anything to help them that way either. Okay, so the whole point is to address function, address neuromuscular function, reverse that stuff, then give them things to reestablish better movement patterns for them. So we're not giving them a protocol. So notice I didn't say, if you see this in the screen, here's the 5 exercises they do. That doesn't work because everybody's different. Or if you see somebody with a flat foot, here's how we fix that. Who cares? Maybe their flat foot is their genetic predisposition. Why are we trying to change that? Okay. So the important thing is get through all the stuff that you guys learned up until now. Now, when we get to the exercise, it's okay. The most important thing with the exercise is, so remember what we went through yesterday relatively quickly, is we're starting with first getting facilitation. Once we have facilitation, then we need to get muscular endurance. Then once we have muscular endurance, then we can start working on sports performance or hypertrophy or that kind of stuff. Okay. So now that we've got facilitation, we need to reinforce that to break the compensation and increase muscle endurance. So that's stage number 1. So that's why when we give them their home exercise program, some people are going to have their home exercise program 3 times a day. So we think they're relatively active, they're relatively good, we didn't do a whole bunch of stuff with them, they're not chronic, they'll hold on to things. Whereas if I give them 6 times a day, they're probably somebody who's more chronic, had more issues that we had to work on. They have to keep on reminding their bodies, keep using what we gave you. Don't fall back on what you've been using for the last 5 years as your compensation pattern. Or they've been in orthotics, and we got to say, okay, their feet look a lot better now. They can do things that they couldn't do on their screen when they came in, but I know that's going to fatigue because they're used to their orthotics doing all this work for them throughout the day. So we have to build up their neuromuscular endurance before we can do more stuff. And the only way we can do that is have them redo their home exercise program multiple times a day. So when we talk about how do we know how often patients have to come in, how do we know how often they have to use their home exercise program, how do we know all that stuff? It's going to be patient specific to their situation, how long they've had their problem, how athletic are they, how active are they. So all that stuff is going to be kind of like baked into how you guys do what you do. So I'm never going to give you a protocol and say, if somebody does this, you do this with them, and then they do that often. Can't do it. Okay, so the protocol is go through the flow, use the flow that we worked on all weekend, use your critical thinking skills that we talked about on Friday, and figure it out for yourself. And then when you play, and if you can't figure it out, play with it. Like, how many times did I say this weekend? You can't make somebody worse. You can make somebody worse with conventional PT. You can't make somebody worse by over-facilitating neuromuscular function. There's no such thing. So you could screw things up by giving them the wrong exercise or say, go run 10 miles when they haven't ever done that before, but that's common sense. You're not going to do that. Okay? Any questions on that?